Okay, so now we're going to talk a little bit more about the Sinew meridians in terms of assessment and treatment. Um, again, a lot of the indications are some kind of either traumatic injury, right, or some kind of wind-cold invasion, or perhaps some kind of stress-induced injury, right? So the objective of a Sinew treatment is to expel any kind of external pathogenic factor that's been trapped and is obstructing the free circulation of the wei qi, of the yang qi, through or across or along the sinew channel trajectory. And so primarily these are involved with pain as well as stiffness, poor range of motion. Okay, so that's really what it's about, is like, and since we're going to be using the Jingwell points, we're going to get to this in more detail. The Jingwells are about powerfully, like, sort of blasting out or opening an exit route for external pathogenic factors to be like aggressively expelled from the body. And these EPFs, as we know, over time can create what's called B obstruction syndrome, right? B obstruction syndrome means there's some combination of wind, cold, damp, or wind, damp, heat. I don't know why they don't say wind, heat, damp, because they say wind, cold, damp, but that's how we often see it in the literature. So if that's been experiencing, even acutely, but oftentimes, more often than not, chronically, that can inhibit the smooth circulation of qi at the more superficial areas of the body, right? The skin, the muscles, the joints. And so pain can result, stiffness can result. And then over time, if it's left untreated, compounded by a poor diet, compounded by excessive overuse of one's qi, that kind of dips into then the principle, right? Not just working off the interests of what we eat, drink, and breathe, then that will lead to blood deficiency. And then when you have B obstruction combined with blood deficiency, you have arthritis, okay? So the objective is to expel any kind of trapped external pathogenic factor out of the sinew channel, out of the body, and then restore the free circulation and flow of qi and blood. So treatment is always going to be about those two things. You know, and again, it's sort of like the basic treatment principles, right? Safeguard the exterior, nourish the interior, right? Expel the evil qi, support the normal true qi, okay? So the way you assess these is predominantly through movement, okay? You know, you can go by signs and symptoms. And again, of course, like as soon as I hear the word stiffness, as soon as I hear the word pain, and they show me that it's at a joint or along a muscle group, then I'm certainly considering sinew meridians. So I want to test those right away. So assessment by movement is essential because really, and according to Jeffrey Yuen, like that alone determines which sinew meridian is injured. And what you may find is that when you're going through the assessments, which I'm going to demonstrate for you and explain, the patient may not feel the pain in the area that's traversed by the sinew meridian. So for example, someone may have pain right around large intestine 11, right, which obviously is along the large intestine sinew channel. Excuse me, I mean, they may have pain there, sorry, which you think, oh, this is on the large intestine channel, this is on the large intestine sinew meridian. But when you test the meridians, the one that maybe aggravates the pain the most, the one you test is the most positive test that creates the most pain recreation, may not be the large intestine. Like, so that's what's kind of interesting, because again, why that may be is these circulate in fields, and these fields kind of blend one into the other, right? So it's not just this line, this direct line of qi, you know, flowing. It's like this field of qi, and these fields kind of like merge, you know, from one sinew meridian to the other. And that's why, you know, the patient may have pain on one channel, but when you test that channel via that specific movement that's associated with it, it may not aggravate the condition. But another movement that deals with another channel, like say the small intestine, that creates more pain. So I believe that that would explain that. So there's various movements that we use to assess the channels. And so we divide these up into groups of yang and yin channels, and particularly the 3-arm yang, the 3-arm yin, the 3-leg yang, and the 3-leg yin. And there's a reason for that, which will be more clear in a bit. But it's very easy to kind of test these sort of like in these subgroups. So yang sinew meridians are always tested with the arm or the leg straight, right? That means the elbow, it's hard to see because I've got my background blurred, but the arms, the elbow will be straight, the knee will be straight. You know, when you're testing the yin channels, the yin sinews, the elbow will be bent and the knee will be bent, right? The arm will be flexed, the knee will be flexed. So yang meridians are tested, yang sinews are tested with the arms and legs straight, and the yin are tested with the arms and legs bent, right? So, and again, when I say straight, it doesn't have to be like super locked, hard and tight, but you want it to be straight and like kind of loosely locked, okay? So small intestine, arm tai yang, is pain upon extension or abduction, right? Which could be lateral extension, moving the arm out, or forward extension, shoulder flexion of the arm. And it's pain during the movement of extension. Excuse me. So it can be pain while the arm is extended, but it's mostly pain upon extension, okay? As I'm reaching out with my arm, as I'm reaching back with my arm. Some also include sort of like reaching behind the arm. And in that case, the arm may be bent a little bit. The elbow may be bent a little bit. A common example would be like reaching into the back seat of your car, or if you have your, you know, for women with a bra that clasps in the back, you know, reaching back to unclasp the bra, right? That kind of like extending out. That's the small intestine, han tai yang. For the leg, well, actually, I'll get to that in a minute. We'll just do the arms for now. So for the triple heater, right, this is arm shao yang, right? This is with the arm straight and you're rotating the arm this way, supinating, pronating, right? So pain upon rotation, twisting of the arm with the arm outstretched and the elbow somewhat locked, right? This type of lateral and medial rotation of the joints is Shaoyang. So that would also include the head. So if I am rotating the head, right, left and right, or if I'm rotating the torso at the waist, left and right, that's another way of testing it. But this is a rotating or twisting. And then large intestine, pain upon the large intestine channel, which is the arm yang ming. This is when you're stopping a movement or bearing weight, right? A holding type movement, a gripping movement. You're holding something with the arm straight out, right? With the arm like in a relatively stationary position, right? So, you know, maybe holding a cup of coffee or some kind of weight in the hand or the arm. You can even test it where you put the arm straight out and then you press down very gently against the hand or the arm to bear the weight of that resistance. Pain from that test is a positive test for the arm yang ming, han yang ming, which is large intestine. So the yin arm channels are tested with the arm bent. So the heart is the arm bent and then rotating, right? The wrist bent and then rotating, right? Like this, or like this, right? That's sort of like, right, arm wrestling motion, that's sort of like a heart, right? So with the elbow or wrist bent, right? That's the rotating or twisting. The pericardium is kind of interesting, as well as with the liver, right? So the jui yin is said to be, the patient experiences pain all the time. It may be slightly less at this time and slightly more at that pain, but at that time, but if they're feeling pain all the time, that is jui yin. Also, if there's numbness, right, or paralysis or neuropathy, that tends to imply the jui yin are involved, okay? And then pain upon retraction with the arm bent, bringing the arm back towards the body, bringing the arm across the body, bringing the wrist in, right? Bending something or bringing the wrist or arm back into the body, or like raising the arm like this, right? Bringing the hand, like flexing the elbow, flexing the wrist, that is considered to test the lung sinew channel. And then for the leg, we have the 3-leg yang, which would be bladder, gallbladder, and stomach. So the way these are tested as follows. So again, tai yang, which could be arm tai yang, small intestine, but foot tai yang is bladder. This is pain upon extension of the torso or legs. So for example, patients may say, my back hurts after I've been sitting for a long time. And so what I ask them is, does the pain occur while you're sitting, or does the pain occur after you've been sitting a while and then the pain occurs as you're getting up out of the chair, off the bed, right, off of the floor? If that's the case, then that's pain upon extension, and that would indicate the bladder channel. Okay, so getting up from a sitting position and straightening up, or pushing the leg out, right? If the pain is worse upon movement of extension, maybe even like driving or walking, that could be considered bladder. Okay, and again, we'll get into treatment in a bit, but if you make an assessment and your hypothesis is, well, I'm not really sure if this is stomach or bladder. So if you treat the bladder sinew meridian and they get better, then it was the bladder. If you treat the bladder sinew meridian and it doesn't get better, and then you try another channel, like, oh, maybe, it's sort of like, I'm not really sure how to differentiate because they feel it so much through so many movements. Then you try, okay, well, it does hurt a little bit when they're bearing weight. So let's try the stomach, and you treat the stomach sinew meridian and it gets better, then it was the stomach. All right, so it's really that simple. So gallbladder, like triple heater, is about rotating or twisting the leg. So twisting at the knee, twisting at the ankle, with the knee locked, right? So twisting or rotating at the joint. And then stomach is pain upon stopping, bearing weight, right? So this would be like standing still for quite a period of time, or bending over at the hips, and then stopping, right? Sometimes this can overlap with driving, especially if their driving foot is in one position for a long period of time, right? That could indicate stomach. Again, you treat it, if it gets better, that's what it was. And then with the yin leg channels, these are tested with the knees bent or slightly bent. So spleen is like tai yin, right? Like the lungs is upon retraction with the leg bent, or the knees or feet or the legs moving back toward the center of the body. Now, I'm in a sitting position. So if you didn't see the chair here, right? If all of a sudden the chair was made invisible and you're looking at me from the side, I've got my torso bent at the waist, and I've got my knees bent, right? Because I'm in the chair. So here's my thighs, and then there's the knee, and then there's my lower legs. So that's my leg bent, and I'm in this position. So if it's just pain upon sitting and not getting up from sitting after a period of time, that's more spleen, bringing the foot into the body, bending the knees, bringing the legs up towards the body. That is pain upon retraction. So that would be more spleen. Now, kidney is rotational movement with the leg bent. So this would be like sitting with your ankle resting on your legs, right? Like cross-legged, but here's your foot and it's resting on your knee, right? So that sort of figure 4 movement. Or like sitting in like butterfly position, lotus position, right? That would be, stretching that inside of the thigh, and that would be what's been attributed as the kidney, okay? So that's sort of rotating the legs while it's bent to be kind of like crossed, right? And then liver, which is foot jue yin, very much like pericardium, jue yin, is pain all the time, or numbness, paralysis, neuropathy. That could involve the liver sinew meridian. Generally, more often than not, conditions affecting the yang sinew meridians tend to be more acute, while conditions affecting the yin sinew meridians tend to be more chronic. That's not an absolute, but it's more often than not that is the case. So more often than not, that's probably what you'll find. Okay, so I'll leave it there, and then we're going to talk about treatment in the next recording.